2007, I began seeing a patient who was having 4 or more seizures a month, sometimes up to 3 a week. He had tonic-clonic seizures, causing him to fall and hurt himself. He was 8 years old at the time, though his seizures began at 6 months of age. Based on his symptoms, within his first few visits, I suspected he had Dravet syndrome. In 2010, when gene testing became more readily available, we confirmed that he had a pathogenic variant in the SCN1A gene. Despite having a firm diagnosis of Dravet, there wasn't a treatment specifically for Dravet syndrome available in the US. We began trying different combinations of treatments based on his different seizure types, but he continued to have a very high seizure burden. I felt like we were running out of options. I knew stiripentol was available through a compassionate use program, and in 2010, my patient was approved to receive it.
DIACOMIT, or stiripentol, was approved in 2001 for compassionate use. It received FDA approval in 2018 to treat seizures associated with Dravet syndrome in patients 2 years and older and taking clobazam. In 2022, the approval was expanded to include patients 6 months and older weighing 15 pounds or more and taking clobazam.
DIACOMIT really helped my patient. By the time I saw him the next year, he'd only had 1 seizure within a 6-month period. Every patient responds differently to DIACOMIT. My patient went from having 3 to 4 seizures a month to having 1 or 2 breakthrough seizures a year. Not only was he able to go longer and longer without a seizure, but he also wasn't experiencing any serious side effects.
The most common adverse reactions for patients taking DIACOMIT are somnolence, decreased appetite, agitation, ataxia, decreased weight, hypotonia, nausea, tremor, dysarthria, and insomnia.
DIACOMIT has continued to help reduce his seizure burden. He's 23 years old now and has been on the drug for more than 10 years, and it is still working for him. He's still having 3 to 4 month periods of seizure freedom compared with his pre-DIACOMIT baseline of 4 or more seizures a month. Because we can control his seizures, we've been able to reduce and even wean him off one of his background seizure medications. Until 2018, there weren't FDA-approved medications indicated specifically for Dravet syndrome. We are now in a new era of medical innovation where we can get more patients closer to seizure freedom than ever before.
To learn more about DIACOMIT, visit diacomit.com/HCP. Indication: DIACOMIT stiripentol is indicated for the treatment of seizures associated with Dravet syndrome in patients taking clobazam who are 6 months of age and older and weighing 7 kilograms or more. There are no clinical data to support the use of DIACOMIT as monotherapy in Dravet syndrome. Important safety information: contraindications, none. Warnings and precautions: somnolence. DIACOMIT can cause somnolence. Monitor patients for somnolence, particularly when DIACOMIT is used concomitantly with other CNS depressants or clobazam, which is also known to cause somnolence. Decreased appetite and decreased weight. DIACOMIT can cause decreases in appetite and weight. The growth and weight of pediatric patients treated with DIACOMIT should be carefully monitored. Neutropenia and thrombocytopenia. DIACOMIT can cause significant declines in neutrophil and platelet counts. Hematologic testing should be obtained prior to starting treatment with DIACOMIT and then every 6 months. Withdrawal symptoms. As with most anti-epileptic drugs, or AEDs, DIACOMIT should be gradually withdrawn to minimize the risk of increased seizure frequency and status epilepticus. Risks in patients with phenylketonuria or PKU. DIACOMIT for oral suspension contains phenylalanine, which can be harmful to patients with PKU. Before prescribing DIACOMIT for oral suspension to a patient with PKU, consider the total daily intake of phenylalanine from all sources, including DIACOMIT for oral suspension. DIACOMIT capsules do not contain phenylalanine. Suicidal behavior and ideation. AEDs, including DIACOMIT, increase the risk of suicidal thoughts or behavior. Patients treated with any AED for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. Adverse reactions. The most common adverse reactions that occurred in at least 10% of DIACOMIT-treated patients and more frequently than on placebo were somnolence, decreased appetite, agitation, ataxia, decreased weight, hypotonia, nausea, tremor, dysarthria, and insomnia. Pregnancy. There are no adequate data on the developmental risks associated with the use of DIACOMIT in pregnant women. Based on animal data, DIACOMIT may cause fetal harm. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to AEDs such as DIACOMIT during pregnancy. Physicians are advised to recommend that pregnant patients taking DIACOMIT enroll in the North American Anti-Epileptic Drug (NAAED) Pregnancy Registry. Information is available at www.aedpregnancyregistry.org. This can be done by calling the toll-free number 1-888-233-2334 and must be done by patients themselves or their caregiver. To report suspected adverse reactions, contact Biocodex at 1-866-330-3050 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full DIACOMIT prescribing information at diacomit.com.